Thank you, Andrea, for your introduction. And Dr. Guillarte and Dr. Espinal, I think thanks to your leadership, you have assembled a magnificent virtual conference, which is going to be really a milestone in the communication and to sharing information in the region of Latin America and the Caribbean. Well, digital health in the era of COVID and the post-COVID is a topic that I've been invited to share. And this is a theme that I've been working for already a number of years, and I'm happy to share my vision and experience. First, just a declaration of non-conflict of interest from the Carlos Slim Foundation. We are a nonprofit organization committed in the generation of science-based innovation solutions, and also that the foundation does not have any conflict of interest regarding other third-party and acquisition of any products or services. The three topics that I want to share with you today are the digital health in this new global health as a new global health paradigm, then to address the issues around digital health response, and then the digital health in the post-COVID era. It's amazing the pace in which digital health has been moved into a global agenda. We can see here in a very short time, in 2 years, how the WHO organization has really established a commitment and activities regarding the importance of digital health in part of their structure and activities. The same with the UN and the Broadband Commission, and in the last years also, even this year, the Pan American Health Organization with the creation of a specific department around evidence and intelligence for action in health. And just a few days ago, FDA launched the Digital Health Center for Excellence. So there's no question that we are today in a digital health agenda and global agenda. The 5 elements that are involved in digital health are crucial. One is the digital platforms together with the cloud-based services. Today, it's very important to have this digital platform, which include electronic medical records, laboratory records, surveillance systems, and a number of systems that need to move now to be integrated expert systems in order to support evidence-based decision-making, but at the same time to link with the cloud-based services where we can have a robust infrastructure to enable the capacity to do big data. And then there's also the possibility to enhance the outreach of health services through mobile apps and IoTs in order to generate the remote and personal monitoring, and at the same time to take advantage of connected communities through omnichannel. And I'll share some experiences in terms to enhance the engagement with the communities and individuals. And all of this wealth of information comes to be analyzed in a very powerful way through the applied artificial intelligence, as we have seen in a number of information that in the last months we have seen the importance of artificial intelligence in many fields. And this is a figure that I like to show, which is like a spiral that is really that enables the shift towards what I've called personalized public health intervention. And it starts with the concept of proactive, to really be outreach through these technologies, to have the capacity to have risk profiling through algorithms, and from there to move to the preventive individualized interventions, to even be predictive in the outcome forecast, and to have this empowerment and engagement with individuals, and then to have a permanent continuum of care. So everything is at the center with the individual and then the community. So this 6P terminal, it is very important to keep in mind because it has to be integrated and it's going to generate, and it's generating a new path in terms of health systems. So specifically around digital health response, there's no question that today there's an adoption of internet around the region. There's no doubt that there's different levels of adoption. It is around 65, 67% in general, with some extremes. But these differences need to be considered by the digital health platforms. The technology will never be the entire solution, but it has to be seen as the concept that it's not going to increase the gaps for have efficient access. So technology has to be built in a way that enables these communities that don't have this connectivity to also benefit. And unfortunately, there's already technologies that are allowed to include these communities. And maybe technology is going to be an enabler of how can we reduce the gaps so that people have true universal access. But we also have the complement of mobile users. This is data from the World Bank about subscribers. There's a number of countries with more than one subscription per person, but it tells you that there's also that we have that element of technology in our hands that we can use. And then also the introduction of smartphones, which is really moving in a very important path. But just looking at the implementation of health platforms during this year, there's this global digital health network that has assembled information, and we can see that most of 2/3 of the digital health innovations are around surveillance and prevention. That's also telling us the importance that we can use digital health in the concept of surveillance and how to send messages and how to be proactive in terms of prevention. And the other quarter was more around diagnosis and treatment. So this is a very good example of how the digital health movement is really engaging, and health systems and countries are picking up the capacity to do this. I'm going to share with you some experiences. I think this is an example of the importance of partnerships, the importance of academic institutions, because they have assembled a very powerful web that has the aggregation and analysis of the available data. And this shows the importance of health information to make public health decisions. And it's live, it's online, and it has given a lot of information to see the perspective in a global, but also going down to each country. This is another example of the importance of crowdsourcing. This website, the Next Strain, provides this crowdsourcing to see the evolution of more than 5,000 genomes and to start seeing if there's mutations of what are the changes. As you can see, different there's some differences between not to imply that it has different pathology or infectivity, but at least there are different strains that have moved around the globe and in some regions. The other aspect, which is very important, and the need for powerful health evidence has never been greater. And today we have to be very careful. There's a lot of information coming out, and there's a lot of implications around that information. And BMG has made this magnificent exercise of using meta-analysis and assessment of really making an evaluation of the information and to provide a quite updated analysis of what's really moving into the treatment arena, which we have seen in these last months a number of really important contributions that have been sometimes over-evaluated, and then the criteria have changed. So this is also a way to see how this technology and the capacity, the analytical capacity, can be turned into a website and to be shared. But also the PAHO has, as I mentioned already, generated a very proactive agenda through this platform. And it has a number of resources. It is a hub that provides updated information for the region, but at the same time, they generate a platform to share information and to have a number of web seminars, fact sheets, and podcasts. So this is the new era of how we can start sharing information, having up-to-date information, and to make decisions mostly on the information that it's coming online, and to have a capacity to really look at it and to have a real-world vision of what are the decisions to be made. And at the country level, there's a number of experiences. I'm not going to go through all of them, but these are mostly in the era, for instance, of electronic health records, telemedicine, websites that can help also to do surveillance. And I just wanted to share with you this experience that we had in Mexico City with this temporary hospital that we developed the COVID 360 digital health ecosystem. That it is 46 dedicated respiratory triage centers all over the area of Mexico City, where people come in, they are evaluated, they are diagnosed, and they are sent out to different hospitals. And this is a temporary hospital where you can see the system that comes from the referral of the triage center, the ambulance, and the traceability, how it's been managed within the unit, and then the communication with the community, very efficient. There's also post when the patient is discharged, to have the follow-up. So these are elements that are very important to have the entire spectrum of the beginning and the end of interaction with a health unit. Now let me move to the third component, which is the digital health in the post-COVID. There's no question that COVID-19 has brought a huge impact in our health systems, but we have to take this opportunity. We cannot go and do the same things as they were done. And I see at least these 5 areas that we can facilitate and continue with that innovation. One is the modernization of epidemiologic surveillance. I think there's no questions that we need to really upgrade the surveillance capacity in the region. Second is the monitoring of vaccination coverage. I think that today, and I think COVID and influenza and a number of vaccines need to have a well-established baseline and also follow-up in order to have up-to-date information. I'll go briefly into each one of these. Then the issue of the syndemic between NCDs and infectious diseases, not only COVID, but other infectious diseases like dengue or influenza or any other that can be linked, or to have this capacity to analyze together and to act on a preventive basis. Then we have the fourth, which is innovation around patient engagement. And finally, a few ideas around digital trials, that is a trend that it's already going on. So going back to the modernization of epidemiological surveillance, just an experience, Colombia has done this, other countries have done it, is COVID has been really in the monitoring process in the hands of individuals. And it's very important to maintain this trend. If we could do it for COVID, we can do it for a number of other diseases, and to have this interaction with individuals and to have a more active and community-based surveillance system. I think this is the importance of going down to the community. In the case of Mexico City, these applications have been very useful to put the focus on the evaluation and monitoring of high-risk neighborhoods in Mexico City that have allowed to control the pandemic. The concept around vaccination coverage. WHO has mentioned these elements, which I totally agree, and that we need to really take seriously, is the importance of having information at birth, when it's possible, to each person to have a unique ID. And at the same time, to have the inclusion of the information of those vaccines that have been given at date and by the type of provider, and also to be aggregated by geographical level, and then to make this analysis of really real, mostly online, live coverage if possible. And then that will allow the follow-up. We have been in the past very passive around the information, and the information is not really looked at a way that it can be proactively in the decision-making process. And also to calculate all the administrative issues around vaccine supplies, cold chain, and a number of elements that are together with the vaccinology environment. Then this endemic of NCDs and infectious diseases. And I want to share with you, and I'm sure that many of you read this editorial that Richard Horton published a few days ago in The Lancet, where he says, let's look at it in a different way. And let's take the importance of not only looking at the concept of blocking the transmission, but to look at the social groups that are with greater vulnerability, and to start to do interventions in a way that we can really interact with communities and see the perspective of how can we take the vulnerability of individuals to be assessed, but also in the link with infectious diseases. So he considers that it's not only the concept of COVID, but it implies the importance of the syndemic between NCDs as a major factor and infectious diseases. And in this case, I also share my experience in the team, is how can you link information of personalized information as an NCD assessment, and then to have the capacity to have a proactive infectious disease surveillance, and then to come to what I mentioned in the spiral. It is to come up with the capacity based on technology and decision-making process, and to do artificial intelligence, to have the capacity to have personalized risk assessment, preventive interventions, personalized interventions, engagement, and then follow-up, together with all the interventions that can be considered. So this way, we can start looking at the issue of NCDs, which is a very important condition that COVID has really brought up again, that we have a problem in public health with NCDs, and that we now have to link and to have this bridge between NCDs and infectious diseases. And finally, it's also to consider the innovation in patient engagement, the permanent use of mobile devices, the link with call centers, to move into when cost and technology is available, to the point of care and home testing at the same time, and then to follow the tracking process. And very important is the training and awareness of health personnel and the community, and then to have the continuum of care. I think this is a new paradigm that health systems need to really start doing, this concept of a permanent continuing interaction with the community that surrounds a health unit and a health system in general. And finally, as I mentioned, is this concept around digital trials. I think today, the knowledge and the overwhelming pace at which the knowledge has been provided in the last months regarding COVID is an example of how can we also accelerate, and not in terms of to accelerate to be responsible or to bridge phases of any research. It's the importance of engagement and to reduce costs so that the numbers of elements that participate in a trial can increase at a lower cost, and then we can have greater data and more base data that could give us additional information. And there's a number of effective and electronic measures to involve people, to use devices and wearables to remote personal monitoring, and to come also to the several analytical tools for the follow-up, and then to come into the capacity of artificial intelligence to benefit the information and to even shorten the length between the beginning and the end of clinical trials. And then these are other topics that I'm not going to, just due to time, but I think that we can really are at that age of transforming health systems. I think that there's no questions that we need to take seriously the component of continuous education through information systems, to have this online information through LMS. The results-based financing, I think today, digital health allows to do this evaluation of performing monitoring with result-based financing, to look at the supply chain, to generate the importance of embedding expert systems into the technology. And with this, we can have a process reengineering. So this is an entire spectrum of how can we use the capacity of digital health. And it has been already shown in the last months, the power and the possibility that with different innovations and with different initiatives, it is possible. And I want to close with this concept that the COVID has imposed great suffering, first in people, families, communities, economy of societies. So we are, I think, in a position that we need to take this very responsibly. We have to take the advantage of digital health to really move into have a real effective access, to accelerate the effectiveness of our interventions, and to increase the quality, and really move to the universal health coverage as a real, not as only a concept, but to make it real, to be evaluated, to be traceable, and that this is the opportunity that we have. Thank you very much for inviting me to be part of this virtual conference, and thank you for listening.